Good afternoon. My name is Corey McElroy, and this morning I'll be telling you about self-aid buddy care. I'll also be discussing some very important factors, treatments, and also some preventions. So please sit back and enjoy this lesson. Okay, as far as the overview, I'm going to talk about communicable diseases, universal precautions, victim assessment triage, anatomy and physiology, airway management, recognition and controlling of bleeding, shock management, dressing and bandaging, and also fractures and splints. First of all, let's define what a communicable disease is. Communicable disease is anything that can be transferred by either touch or airborne. One of our most famous that we always discuss is the common cold. So one of the precautions for that is make sure that when you cough or sneeze, always sneeze into your arm or beneath there. That way it won't have those particular germs traveling, and always make sure you wash your hands. Next, I'm going to tell you a little bit about triage, which is a French word. And the reason is for the greater good for the greatest number. That's saying that you'll get a bunch of individuals, you'll take time to treat them in a specific order. You always want to get those with the least amount of damage or the least severe injury out first. That also falls under how you would do what's called a victim assessment. In the categories under victim assessment would be you provide care for your minimum care, urgent care, and then you do delayed, which you don't want to jeopardize a life. And then if you're not expecting to live, you always want to do those last. You want to be able to get them back out into the fight. Now we're going to talk a little bit about the body systems. And the first system we're going to discuss is the central nervous system, which comprises of the brain, the spinal cord, and your nerves. They control unconscious muscle movement, and it controls the responses, the fight and flight. Next, we're going to talk a little bit about give you a little bit about the respiratory system. That is your main for O2 intake and CO2 elimination. What muscle does the entire active breathing rely on? That's right, you got it, your lungs. Another and probably one of the most important facts of the body system would be your circulatory system. It can consist of your heart, vessels and blood. They regulate your body temperature. It removes waste. Did you know that an average adult would need heart pumps 5 liters of blood per minute? And do you know some of the places your heart rates can be felt? You can check it on your temple, your neck, the heart itself, right here in your muscle, your veins, and you also have little areas in your thigh and ankle. Another part is your skeletal system. There are 4 major functions to support your movement, protection, and storage. And the musculoskeletal system, it also involves the body and the fluid movement and posture. I'm going to move on now to recognition and controlling the bleeding. There are three types of bleeding: the signs and symptoms of bleeding, and some methods of controlling bleeding. This falls under your circulatory system. The 3 vessels are your arteries. They carry blood away from the heart. Your veins carry blood to the heart in a steady stream. And the capillaries, they carry blood to your tissue. An average adult can lose 1 pint in 15 to 20 minutes, which can also lead to shock. That's just a little heads up for you. Some treatment for external bleeding is you want to apply direct pressure, you want to elevate, you want to cut off pressure points, and you also want to apply tourniquet. A tourniquet would be applied as a last resort only. In internal bleeding, there's a rapid to weak pulse, loss of blood volume. You'll feel cold, clammy, pale, sweating, and you have a loss of body temperature, dull, dilated, slow reacting pupils. You're thirsty, restless, and very combative. Shallow and slow bleeding. You need more oxygen. And chest bleeding is really difficult to detect, and an abdominal bleed is rigid and warm. Shock management. What is shock? Shock is a collapse of the cardiovascular system, the brain and heart, most sensitive areas. What are some major causes of shock? Circulatory problems and allergic reactions and infections. Some of the signs and symptoms of shock are weak and rapid pulse, cold and clammy skin, restlessness, anxiety, confusion, thirst, nausea, dull, diluted, slow to react to light, shallow, rapid, labored breathing. Some of your treatments for shock. You would want to control the bleeding. Bleeding. Again, elevate at least 12 inches above your heart to keep the blood from going down. Unless that particular area is injured, you will always want to splint particular areas. If so, prevent loss of heat, and there's nothing that goes to the mouth. There are dressing and bandages on. Next, dressings. They cover your wound. Bandages hold your dressings in place. We have sometimes what's called a sucking chest wound. In a situation like that, what you want to do is you want to take, I'm trying to think how to describe it. You want to take all your bandage and keep around the area where you'll see like bleeding bubbling up on there. Let's go on to fractures. Signs and symptoms are deformity, tenderness, swelling, dislocation, and grating. And some principles of splinting in case of fractures: you want to support the broken bone. You want to remove all clothing from that particular area. You need to make sure you're constantly checking the pulse. And a golden rule of splinting is you splint them where they lay, you splint them how they're found, you use padding, sling, or slate. In case of spinal injuries or neck injuries, you want to make sure that you don't move them at all. You want to try to keep their neck and head as stable as possible. In dealing with chemical environments, you need to know your history of chemical agents. They've been around since World War I, and there are two main categories. Mild and severe signs and symptoms of poisoning: runny nose, sudden headache, sudden drooling, dimness of vision, tightness of chest, stomach cramps, and nausea. And for severe symptoms, it could be strange or confused behavior, wheezing, difficulty breathing, pinpointed pupils, red eyes, twitching spasms, and uncontrolled passing of urine and stools. And that can also lead to death if it's severe enough. Trying to think. Okay, I'm going to move on to heat-related injuries. I'm just going to describe a little bit of the signs and symptoms of heat, cramps, heat exhaustion, and heat stroke, and then I'm going to list some of the treatments for it, or explain some of the treatments. Heat cramps. Those are spasms in your legs or arms, and they normally come from strenuous exercise. Treatment for that would be rest, remove from heat, and drink plenty of fluids with electrolytes or salts. Heat exhaustion, you become weak, dizzy, you're feeling faint, headache, vomiting, nausea, your skin becomes cool or gray. And those are the most common symptoms of heat exhaustion. Treatment for both of those, again, remove from heat. You always want to treat for shock just in case. You want to loosen the clothing and quickly remove, you want to lower the body temperature. And if they're conscious, you always want to make sure that you're constantly forcing water in them. Cold-related injuries, I'm going to state signs and symptoms of frost nip or frostbite, signs of hypothermia, and then I'm going to state a little treatment for both. Frost nip is the start of freezing, fluid starts, the skin turns red, and then it starts to go to white. With treatment, you want to prevent further exposure and move into a warmer environment. Frostbite, that's when it goes untreated. Frost nip goes untreated. Your skin becomes white and waxy, and your entire tissue starts freezing. Hypothermia, that's gradual lowering of your body temperature past 95 degrees. It's caused by wind chill, inadequate clothing, fatigue, alcohol, and poor health. next, I'm going to discuss burns and burn injuries. I'm going to give you the signs and symptoms of first and second degree and third degree burns, and I'm going to also tell you about first aid treatment. A first degree burn is only the top layer of skin is burned. It's red, painful, and swelling, and a good example of a first degree burn would be considered sunburn. Treatment, you will stop the burning process. You treat with cool water until your pain is gone. Second degree burn is the first two layers. It's like a first degree with painful blisters. That could be like a hot water burning on your hand or a flash flame. You treat that by cold water and applying a dressing, and then you'd also treat for shock. Third degree burns are all layers of the skin are burnt. You won't have any pain, and that's normally coming from a fire. The treatment would be to stop the burning process. You can't remove the clothes, because if you try to remove the clothes, you're liable to pull that skin away. You want to cover with the dry dressing. You want to treat for shock and transfer to a medical facility as soon as possible. I briefly just talked about some of the things on victim assessment, triage, some anatomy and physiology, some communicable diseases, recognition and controlling the bleeding, bleeding, shock management, dressing and bandaging, and fractures and splinters. Well, that concludes my portion of what I was discussing on self-aid buddy care. I hope you enjoyed your presentation, and I'll take all questions after class. Thank you.